Hello, everyone. It's Monday, June the 6th. And this could be because, it's a Monday and we're just going through the weekend and we don't have all the reports in, but we've had 6 additional deaths since my last briefing. That's 6 too many naturally and everything, but it's surely better than where we've been and where we've had to go through. But if you'll join me in respect and honor for these great people that we've lost, please do in your prayers. The 6,972nd death is an 82-year-old female from Kanawha County. The 6,973rd death, a 90-year-old female from Ohio County. The 6,974th death, an 82-year-old male from Kanawha County. The 6,975th death, a 94-year-old male from Fayette County. The 6,976th death, a 70-year-old female from Raleigh County. And the 6,977th death in West Virginia is a 94-year-old female from Mercer County. Many, many prayers for these folks. We have 2,547 active cases in West Virginia now, 1,700 new positive cases in the last 24 hours. The daily positivity rate's at 9.35. The cumulative rate is at 8.14. We have recovered cases in excess of 510,000, 192 that are hospitalized now in West Virginia, 31 patients in the ICU unit and 11 on ventilators. All of our counties are green and yellow, but it looks to me like the yellow is beginning to take over the state. At one time we had them all in the green, but we want to, having them all in the yellow and the green is not too bad, but we don't want this thing to keep sliding and get worse. I remind everybody over and over about the booster shots. I don't know how many times I've said exactly that, but especially those 50 and older, please go get your booster shot. It is so, so important. And if you're out of the time period from when you should have gotten your booster shot, you're really, in all honesty, out of any immunity to speak of at all. And so you're just winging it. And we know how infectious this stuff is, and it can absolutely whiplash around on us and result in death, surely in hospitalization. If you have your vaccines, that's pretty dadgum rare, and so they do their job. They protect us, and we should really take heed to that. From as far as the vaccine distribution update, we still continue to just slow but sure crawl along and everything. We have 83.8% of the 50 and olders that have received at least one shot. We now in the state of West Virginia have 979,441 people out of a total population of less than 1.8 million, that we've got almost 1 million people that are fully vaccinated. So we're going to keep up, as far as reminding you and asking you to go and seriously consider the vaccination. Thank goodness we have incredible results as far as the 65 and older and even the 50 and older, but we're lagging way behind with our kids, and we really need to think hard about what we're doing there. The vaccine calculator, the information is all up and everything, and we'll remind you as to when your vaccine or your boosters are due. And so if you would, get registered on that. From the standpoint of all the information on our COVID vaccine line, it's all on our website, as well as all the free testing information. 80 outbreaks in our long-term care facilities, none in our church community. Our inmate population is jumping up. 142 inmates now have COVID and everything, and there's 21 staff cases as well. I remind you over and over about the rental assistance program, the homeowner assistance program. They are so important, and you can absolutely derive real dollars here if you'll just call us, and we'll try to somehow get you qualified. We'll comply with all the rules, but if you'll just call and spend a few minutes with us on the phone, it may very well pay major dollars to you. And we want to help all those that are out there that are struggling in every way. And so with that, please consider calling us. From the standpoint of giving blood, I remind you about doing that. It's so important and everything. And here's something that is a tragedy beyond comprehension. You know, the very people that I say that we owe everything to, our military, our veterans, our active military, our first responders, the same thing. We had a tragic thing happen to a Nicholas County deputy, Tom Baker. We lost him, you know, on Friday night when he was shot in an incident that he was responding to. We had another deputy at the same in the same situation that was shot in the leg, and thank God he survived and everything. But these people are no question heroes beyond belief. Heroes that we absolutely owe each and everything to, everything. Can you just imagine, you know, in my opinion, they're always underpaid and underappreciated. And they're absolutely the very people that we call when we're in trouble. And they come running. And they absolutely try to protect us in every way that they possibly can. It's a tragedy beyond belief. It needs lots and lots and lots of your prayers. And Kathy and I have joined in many prayers for these great people and all that they're doing, but especially this family of Tom Baker. And so, you know, a man that gave us so much and was loved by so many. So please keep them in your prayers. We made a federal disaster declaration to FEMA. You know, we sent up the request. I went down to Huntington, you know, when this flooding occurred, you know, just a few weeks past and everything. A lot of folks really hurting, and it brought back horror memories to me in you know, in the flood of 2016 and where, you know, I walked many a street and saw many folks, you know, cleaning, and as we walked through mud and everything else, it just, I saw them bring all their possessions, their memories of their life, you know, of their house right out into the street, mud all over it and everything, and just dump it right in the middle of the street. And then dump trucks came by and picked it up, and off they went. Memories for a lifetime. I saw his look for 6 weeks for a little 14-year-old girl that was miles and miles downstream when we finally found her, you know, that the flood had killed her. So many tragedies beyond belief. And so when I was there, you know, I said to all the people, I wasn't going to quit trying. It looked like that they would not FEMA qualify and everything, but I wasn't going to quit trying. And a lot of people, we flipped rock after rock after rock, and we finally reached a threshold to where, from a federal standpoint, we were at the threshold to qualify for FEMA. So we sent it up. We sent it up when we hit that threshold, and I am very hopeful that it will be approved, and if it's approved, it will help substantially to all those folks that were hurt really bad. So you know, let's be hopeful that the Biden administration is going to approve this, you know, our declaration that we sent up and everything, and so let's hope for the counties of Cabell, Putnam, and Roane counties we get some real relief through FEMA. This morning, I awarded a combined total of $5.5 million in grant funding for a pair of programs that are going to help many West Virginians. One was a $5.4 million grant that's going towards our West Virginia Community Corrections Grant Program, and these dollars will fund 30 projects across our state, assisting local communities in the establishment and continued operation of community corrections programs. So that's really good. And the other one is a $2.1 million grant that's going towards all child advocacy center grant programs and everything. It's going to be 22 projects across our state, you know, that will help with the growing problem of child abuse. I don't know how, and neglect. I don't know how in the world there could be anything as bad as just that. Child abuse and neglect is just really terrible. And so this won't solve the problem, but this will help. And so I'm really proud to have been able to do that. And you know, I want to announce that our DHHR consulting contract, you know, there's been There's been a lot of discussion about DHHR over the past few weeks, especially. You know, the legislature, I think, very hastily tried to get out, you know, a modification, and while their efforts may have been good, you know, I've said this many times, but you know, if you're walking through the woods, and you know I've got a lot of stories, but if you're walking through the woods and you look and 10 feet away, there's a rattlesnake all coiled up there. What do you do? What do you do if you're smart? Lots of times rattlesnakes travel in pairs, and if you just react and jump, you know, you could jump on his buddy, and that'd be really bad, wouldn't it? But that rattlesnake 10 foot away can't hurt you. And so really and truly, if you'll just stand still just a second and look to the left and look to the right and look behind you, you can plot a path to go, a path of safety and a path of goodness. That's what we needed to do with DHHR. We just didn't need to jump on a 2-page deal and run the risk of losing federal funding on something and really hurting a bunch of folks. What I wanted to do is bring someone in to do a top to bottom review and listen to what they have to do. Consult with the legislature and work with the legislature, and we have awarded that contract now. And that contract has been awarded to, I think it's McChrystal, the McChrystal Group from Alexandria, Virginia. You know, the McChrystal Group provided a cost estimate of $503,000 for the organizational assessment of DHHR and $578,000 to develop a strategic plan. It's expensive, but they will absolutely go through top to bottom, and we will be in constant contact with the legislature. I welcome anything to make things better. There's never been anything around me to hide, nor will there be anything to hide. Absolutely, with all in me, I want to make things better. But I remind everybody, there's been a whole lot of folks that have been here a long time. I've been here now going on 6 years, and these problems did not get this way on my watch. Now, we can make them better, but we want to make them better making the right decisions and not jumping fast enough that really and truly we end up hurting a bunch of folks in trying to just do something. You know, we'll get to the bottom of this. We'll flip every rock that we possibly can, and I welcome any participation and help from the legislature in every way, but we got to get somebody to go through a top to bottom review and then make some real improvements to DHHR like we've done all across the board in a lot of different directions with a lot of different things that we've done here. So with that, all that being said, I think that's all I got right now. Thank y'all.
All right, thank you, Governor. Let's now hear from Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor said, we know from data that is coming out actively from the Omicron infections in parts of our country that vaccination is playing an important role in reducing the risk of death and severe disease with people who suffer from Omicron infections. And the Omicron variant of COVID-19 is different than the variants we've seen to date because it is much, much better able to avoid our immune responses. And therefore, having up-to-date vaccination becomes really critical, even in people who have had a previous Omicron infection. Turns out that the immunity just solely from getting infected and recovering from Omicron is not sufficient to protect our population in the way that we want to. And in fact, it's also really important to get up to date with the vaccines. And currently in the US, only about 5% of people who are eligible for a third booster dose have gotten one, according to data that I've seen as recently as today. So ultimately, we really, really want West Virginia to continue to be leaders in that category. And particularly, we know that older Americans, older West Virginians are bearing the brunt of the Omicron infection from COVID-19. And if you've been a long time since your last vaccination, 4 to 5 months or greater, then it's really important that we compel each person to check the vaccine calculator. And if you're due, please get your most current vaccination. That makes a huge difference. And we want to make sure that nobody else dies of a disease that we can treat today, both preventatively by full vaccination and up-to-date vaccination and being careful. But if you do happen to test positive, we do have treatments that still work against these variant forms of COVID-19 as well. But we will need to know that you have an infection so that we can make sure that we are able to get you the treatment you need. Thank you very much.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just reinforce a couple of points made by the governor and Dr. Marsh. We continue to see our RT rate bounce back and forth just above 1. So we know we still have transmission going on in our state. We continue to work closely with a number of partners in our interagency task force, our community partners, particularly the West Virginia Healthcare Association. As the governor pointed out, a number of outbreaks and outbreaks in our nursing home facilities. We know that we need to continue to educate both those residents as well as the family members who have responsibility for those residents to make sure that they understand the value of the booster and that second booster shot, particularly for those above the age of 50. So we will continue to work that. Also, as the governor pointed out, we are watching closely our hospital numbers. We're now up to 192 in our hospitals. As was mentioned at our last press conference, our threshold in the past has been 800. At one point, we exceeded that to a level of 1,100, but now based on staffing issues and other challenges that we see in our hospitals during these summer months and coming into the fall and winter, we are at a point where we have to watch closely to make sure we don't get above 500 in our hospitals. So we will continue to watch that closely as well. Last thing, I'd leave you with two things. One from my family and I to Deputy Baker's family and all the residents of Nicholas County. We send our thoughts and prayers at the loss of a great West Virginian and a great American. And I also like to point out today is the 78th anniversary of the landing at Normandy and D-Day. A number of great Americans put their lives on the line. And I say Americans, they went not based on political party or state or rural versus urban. They went as Americans and they fought to deal with a terrible, terrible threat that Hitler presented to the world. So let's pay tribute to those individuals by, again, focusing on being Americans. Thank you.
All right, thank you, sir. Next to Dr. Aina Amjad, our State Health Officer.
Good morning. After today, the National Center for Health Statistics is transitioning to a new coding system that's going to be for about 2 weeks. So this is impacting all 50 states. So during this time, West Virginia's ability to report COVID-19 deaths is going to be a little bit slower, and also overdose deaths. Our Bureau for Public Health is still going to be certifying reports through our death reporting system. However, due to this shutdown, which will last until the 20th with the National Center for Health Statistics, we're unable to code and certify some of the deaths. So you might see a little bit of a slowdown in reporting numbers for the next 2 weeks. Thanks.
Thank you, Doctor. Secretary Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about monkeypox. The first potential case was identified in DC over the weekend. I just wanted to know from the health experts, is that something we're keeping an eye out for in West Virginia? Have we identified any cases yet? Thank you.
Maybe Dr. Amjad, maybe you can take this, or Dr. Marsh. This is way past me.
Yes, Governor, I can start. Charles, to answer your question, we are keeping an eye on that in West Virginia right now. We have pushed out several informations to providers and labs on how to handle a case if someone comes in suspecting monkeypox. We do not have any cases to date in West Virginia. However, we are prepared to address anything that we need to. I don't know if Clay has anything more.
The only thing I would add is that this is a very unusual outbreak that we're seeing of monkeypox that is really in many places throughout the world. And more folks are watching this, and the presentation of the monkeypox that has been described has been a bit unusual. These are not with pox marks and blisters that have broken out throughout the body. They can be single marks, and they can also be located in genital and rectal areas. So if you notice something that is different, even a single blister or a single area on your skin, worth mentioning. There's been not that many cases that have been defined worldwide, about 800, I think, but still this is a very unusual finding, and we are watching it carefully. There is, smallpox vaccine should still have some ability to reduce the risk if you do come into contact. And this is a person-to-person contacted disease. So if you do have a lesion anywhere on your body, even a single one that looks unusual, please contact your primary care physician.
All right, thank you, Charles. Next, we'll hear from Megan Beshara with WCHS and Fox 11.
Hi, thank you. Yes, Megan Beshara here, Channel 8 News. It's a question for Dr. Marsh or Dr. Amjad about long-term care facilities. Governor had mentioned about 80 outbreaks in long-term care facilities right now. How concerned should we be for our elderly population regarding COVID right now? Yeah, thank you.
Dr. Marsh, maybe you can go first on this.
Thank you, Governor, and I am pleased to follow up. Thank you for the question. We know that particularly with this variant, subvariant of Omicron of COVID-19 being the BA2 variant and the BA12 or BA2.12.1 variants are both more infectious than any other variants that we have seen to date. And as we watch the population that is at the most risk to get infected or reinfected, it is older Americans. As we said before, if we look at the percent of deaths from COVID-19, about 26% are in Americans over 85, about 52% in Americans over 75, about 75% in Americans over 65, and 95% in Americans over 50, and also in people that have immunocompromised status because of medicines they're taking, like steroids or rejection drugs from transplants, or because of having active cancers, getting chemotherapy, et cetera. So we know that the oldest part of our population are at the highest risk today from the Omicron variant infection. And that's the reason why it's really so critical for us to maintain, up-to-date vaccinations, and also to monitor closely all of our older population, because if they do test positive and if they have broken through even previous vaccination that has been more than 3 or 4 months ago, then we want to be able to identify them quickly so we can get treatment, whether it's with the oral medicine, the Paxlovid, or whether it's with monoclonal antibody bebtelovimab or the antiviral agent remdesivir. So really important for all older West Virginians, and particularly people that might be compromised and in long-term care facilities. And we're working with the Long-Term Care Association to make sure that we are continuing to define anybody who does need a vaccine to offer that to them. But really important because the older part of our population is taking the brunt of the Omicron infection problem that has the most severe consequences.
Thanks, Clay. The only thing to add to what Clay said, Megan, is that if you're going to go and visit a loved one in a long-term care facility or assisted living, if you're not feeling well, obviously don't go visit. If you're able to take a test, recommend you take an antigen test before you visit your family members, and also, if possible, to wear a mask while you're around them, just to their risk factors that Clay mentioned. Thanks.
All right, thank you, Megan. Next, we'll hear from Stephen Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Governor, with June legislative interims scheduled for next week, the second tranche of American Rescue Act plan dollars in hand, and with at this point more than $313 million in surplus tax dollars, once you factor in, we got $1.1 billion of surplus, and then we've got $793 million in surplus items in the back of the budget. So we've got money to play with going into the next fiscal year. Are you considering calling a special session next week or soon and to appropriate some of these dollars? And if so, can you give us a preview of what might be on a possible special session agenda? Thank you.
Stephen, I can't give you a preview yet, but we're working that, and from the standpoint of the possibility, while I've got you, from the standpoint of the possibility of calling a special session, I am considering that. And I've done a lot of thinking, about this, maybe a gas tax holiday. And I want to hold up just a little bit longer, maybe until our next briefing. I think our next briefing is going to be on Wednesday. But between now and then, I'll make a decision in regard to that. I do think that if we can help our folks, and I believe that there's surely enough room to be able to help, but I do think that that's something that maybe, just maybe, especially with families, especially right now, thinking about going on vacations and things like that, that if there's a way to help a little bit, for maybe 1 month and take a 1 month holiday and everything, and I don't think it would be detrimental to us from the standpoint of our ability to be able to do all the good stuff that we do in regard to roads. But I will be coming to you with a list of things, that we may very well be going to a special session on the dollars that we have, as far as surplus dollars or ARP dollars or whatever like that, but I need to do some more work with our people, with the legislature, and as far as opportunities that we can do there. But I've done an awful lot of thinking about, from the idea of being able to give a little back and without it really hurting and everything. The bottom line, we want to continue to repair our roads. The dollars that'll be coming back, will be not really all that significant dollars for people that are only filling their car up, maybe twice a month or once a week or whatever like that. It won't be an unbelievable amount of dollars that they'll be saving, but it will help some, and maybe it's something we ought to do. And so I'm really thinking real hard about that, and I'll give you a decision on that in the next day or so here.
All right, thanks, Stephen. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. This is a wide-ranging question about COVID fatigue. In cutting back on the testing opportunities, Governor, I think that is kind of a tip of the cap that is going on now, where you referenced that some sites would have maybe only 1 or 2 or 3 people coming by in a day. COVID fatigue, how do you assess it? Are we there? And what do we do about it? Thank you.
Well, Paul, we're there. And we're there with COVID fatigue over everyone, whether it be General Hoyer or Clay Marsh or, Dr. Amjad or whomever it may be. Everybody's there. the reality of the thing, of everything is just this, is there's been a lot of conflicting information that's come out of D.C. And we act on information, and then all of a sudden it proves out, Dr. Fauci tells us one thing, and then it maybe very well comes out, no, that's not exactly right. We're going to go another direction. Well, that causes fatigue in itself, but Paul, all I know we can possibly do is try with all in us to continue to bombard people with the fact that we respect their freedoms, and we're going to stand with that. But at the same time, we absolutely have had vaccines with us forever and a day. And vaccines absolutely save lives. And these vaccines that we have now have been proven to be incredibly safe. And we need to encourage people every day to try to continue to get more and more and more folks across the finish line. Sure, there's absolutely COVID fatigue all over the place. And the sun's shining, and everyone is, out feeling pretty decent and everything right now. It is something we've got to live with. We've said it over and over and over. There is a real way to live with this, with the vaccines, and there's a real way to stop it. But it's tragic, Paul. It's tragic, just like today. We read through 6 more deaths. 6 more deaths. It is absolutely tragic, and we can stop it. And the fatigue surely slows us down, but I only know one way, and that is just keep working and keep digging, and that's what we're going to do.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and staff, and let me lend my voice to those offering condolences to Deputy Tom Baker's family. I'm a former law enforcement employee, and these things hit us all pretty hard. And God bless him, and God bless the people of Nicholas County. Governor, the question I'd like to ask you today is regarding the state economy. The economics firm WalletHub.com came out with a list of the best and worst state economies in the nation today. And at the very bottom, in 51st position, is West Virginia. They were particularly critical of they ranked us last in innovation potential and low scores for a low share of tech jobs and a lack of startups in the state. Given all the economic news of this year, I assume you would probably want to refute what WalletHub is saying, but what is your reaction to them naming West Virginia as the worst state economy in the nation?
Well, Mark, you live here, and you see what's going on every day. And if this is the worst in the nation, this is where I want to be, and I mean, the most beautiful state, the most beautiful seasons. We live in paradise. We have the lowest record unemployment that we've ever had, and on and on and on, whether it be the surpluses or what we're doing with a diversification of economy and everything else under the sun. Let me tell you, you're dealing with a bunch of liberal fruitcakes. That's all there is to it. Liberal fruitcakes. What is WalletHub all about, really and truly? They're actually trying to tell us that the great California, the great, let me just make sure I got this right. The great state of Washington, the great state of Massachusetts, absolutely, the great state of Oregon. These are the ones that they think are just doing great stuff. Great stuff. But if you're a relatively red state or Republican state, you're not even considered. You're absolutely not even considered. So what is it really and truly? Is it a true evaluation, or is it just more political garbage? And it's garbage. I mean, our state is racing ahead with people wanting to come to West Virginia. Now, have we been behind in decades of the past? Well, you dadgum right. And I'll promise you, when I walked in the door, it was absolutely doom and gloom. But absolutely today, if you don't believe in West Virginia, I would say that you're just this. We don't need you to come here. If really and truly you don't believe that, because we know what we're doing here in West Virginia. We want to welcome everyone to, but that's me, the doom and gloom of a bunch of liberal fruitcakes, you know. So, and you know, I could go on, and I could tell you things like, think about the pension system in West Virginia today versus California. Think about the tax system today versus California. Think about what those people are living in. They can't see across the street in California because of the smog. They're having brownouts and everything, water shortages, everything under the sun there. Paying taxes out to yin yang. But yet, California is first. Are you kidding me? You know, at the end of the day, all the got going on. Our pensions all across the board in the state are almost fully funded, surplus after surplus. Absolutely, tourism is exploding, diversification, unemployment at all-time lows, surpluses beyond belief that we can do great stuff with and are doing great stuff with. You know, like I said over and over, job opportunity off the chart. You can live in paradise and have a great, great, great job, raise a family with, you know, faith-based people, absolutely, you know, low crime, all the different great things that are going on in West Virginia. You know, nope, I'm telling you, I can't buy this one, brother, but I love you so much, I thank you.
All right, thank you, Mark. Next, we'll hear from Randy Yohe with West Virginia Public Broadcasting.
Good morning, everybody. Randy Yohe here with West Virginia Public Broadcasting. I think my question is for General Hoyer, because we're hearing all around the horn today that senior citizens like me should have their second booster. When we're finding out that in some of our nursing homes where we led the way early on, that they don't understand the need and that family members are not giving consent. General Hoyer, you mentioned that you are going to do some more informing and educating. Specifically, how are you going to do that to make sure that our seniors in our nursing homes are getting that second booster, or at least understand why they should?
General, please.
Yes, sir, Governor. So, Randy, yes, currently engagements going on through the West Virginia Healthcare Association, led by Marty Wright. We are doing a number of different things, educating and providing the development of materials to educate residents, as well as providing materials to go to family members who have the legal power to make decisions for other residents who are in facilities. And that is an ongoing effort that we will continue to press. And as the governor pointed out, we're doing that not just in those facilities, but across our population over the age of 50. And we know how important that is. And we know that slowly but surely we continue to get more folks boosted, but we will continue to ramp up additional efforts going forward, because we know, as you pointed out, how significant this is to that over 50 population. Thank you.
All right, thank you, Randy. Governor, I'll turn it back to you.
Okay. Let me just see. I'm not, you know, I didn't expect you to come back that quick. One thing that General Hoyer said earlier, and I want to reiterate this, you know, today is the 78th anniversary of D-Day, where we landed on the beaches and so many lost their lives. And I've said it over and over and over and over. What do we owe these people? What do we owe them? We owe them everything. We owe them everything. Think of the courage that it took. Think of really, really what it took. And think of all the families that had to, you know, suffer through the ultimate sacrifice. Think about what's going on right now with Tom Baker's family. You know, think about just absolutely how great and how essential these people are to everything we have in life. And so take time at least today to pause just for a second or two and remember, You know, if you're way, way, way too young to remember, just think back about what your grandfathers or great-grandfathers or whatever have told you. Think about all the history books of what they've told us and everything that all these people did. Please remember a great deputy in Nicholas County and another deputy that was shot and all the people in Nicholas County. Absolutely, please take time to remember those that protect and look after us every day. You know, from the standpoint of the only other thing that I've got that you know, I think Brad McIlvaney was on, and then he had to drop off. I'm sure he had to go somewhere or whatever. And but you know, there was some thought that was brought up about red flag laws, and I want to tell everybody just this: there's all kinds of problem with these red flag laws, and for anybody on this planet that would think that that I condone almost anything in the world that President Biden would be out doing, I just think, you know, you talk about polar opposites. Now, we are on polar opposite ends. That's period. You know, with the fact of any law that would pertain to a gun or taking of a gun of people and individuals and everything, in this state or in this nation, we need without question to have due process protection. We need to have a judge direct us and tell us as to what to do as the first step, you know, to anything. So, you know, I hate Brad was, you know, dropped off because I would have answered him exactly the same way. You know, from the standpoint of my statement before in regard to assault rifles, I do believe that 18 years of age is too early in life. But at the same time, you know, we go to war. We go to war with assault rifles and everything. Absolutely, I believe wholeheartedly that putting a ban against assault rifles is a Band-Aid for cancer in this situation. What we need to do is have a comprehensive, big-time discussion about all the things that are causing this to happen. You know, from the standpoint of raising the age on assault rifles from 18 to 21, I'd probably be supportive of that. But does that mean that I believe that we should try to get rid of assault rifles? Of course not. That's completely silly. And in fact, to be perfectly honest, our assault rifles are protecting us in many situations today. How many home invasions do we have that we don't even know about, where someone in the home had an assault rifle that was able to save their family? How many situations do we know of just that? You know, so sure, you know, there's situations where I think that, you know, kids 18 years of age, you know, going out and buying an assault rifle, we could move that age to 21. I'd probably be supportive of that. Would that solve anything? No. Will that solve anything? I don't think so. If we want to find a way to solve something, let's take on the whole problem. The whole problem is just simply just this. We bombard our kids from 7 or whatever years of age with the terrible pornographic stuff. Many times the music they hear is laced with profanity. Absolutely, video games that are so violent they're off the chart. Are we willing to do something about that? Absolutely, today, kids, with all the stuff on social media, the bullying and everything, kids are faced with more obstacles than we can possibly imagine. We allow crime to run rampant all across this country. We say, if you don't steal anything more than $1,500, you let you go. I saw a thing this morning on TV that a person had been arrested for some level of shoplifting or stealing 47 times. Continue to let them go. 47 times. And we may say, well, we can't put them in jail. He's in jail. What are we going to do? Well, if you ask Jim Justice what we do, we build more prisons. We absolutely don't turn them loose on the street. We build more prisons. And if that's not enough, double the prisons, triple the prisons. Absolutely, we've got to be sure that people know in this country, if we do something bad, there's consequences. Absolutely, this day and time, it isn't a matter of doing what's right and staying away from what's wrong. It's all about what you can get by with. and we're allowing people to get by with anything and everything. We need to amp up our mental health all across this country. We absolutely do not need to throw $10 at it. We need to throw real money at it. We need to amp up our absolute concern about our kids from the standpoint of all that they're bombarded with. How can we not possibly have a few kids fall through the cracks? And as they fall through the cracks, bad stuff happens. We need to do something about it, don't we? We need to absolutely try to ensure that the schools are as safe as they can possibly be without invading and changing the way children perceive that place to be a place of learning, a place of safety, a place that they want to be at with their friends and everything. Well, absolutely, I would be all for doing everything we can possibly do. Putting an armed guard in every school, or maybe multiple armed guards in every school. Paying the price of absolute safety for our most cherished is absolutely what we should do. But if we don't look at this as a whole, and we're not willing to do the whole, then all we're doing is putting a Band-Aid on cancer, and at the end of the day, it won't work. It won't work. The Biden administration wants to just do something so they can say, I did something. I stood on a soapbox and did something. They don't want to tackle the whole problem. Absolutely, there's too many areas, too much pushback. They don't want to tackle the whole problem. Too many politicians want to do just that. They want to just get up on a soapbox and say, look what I did, and they don't want to attack the whole problem. If you're not willing to tackle this entire issue, at the end of the day, I hate to say this, but at the end of the day, it's just going to get worse. It's just as simple as this. If you're 60 or 70 years of age, ask yourself, when we went to school, did we have anything like the problems that we're having today to contend with? There's no way. Were things better then? Were they easier then? In most ways, yes. Are we willing to do something about it? Are we willing to tackle the whole problem? And if we are, things will change. And if we're not, we're going to have the same kind of stuff over and over and over. It's tragic. It's tragic beyond belief. To me, people got to have enough guts to stand up and tackle the whole. In this situation, just standing on a soapbox and so you can say, well, look what I got done, it's not going to do much of nothing. Anyway, thank y'all so much. That's all I got.